This is the Team FHIR-FLI presentation for the Path to Production series. Team FHIR-FLI was coined in the ACL Social Care Referrals Challenge and is a collaboration between two startups, MayJuun and Open City Labs. My name is John Manning. I'm the CEO of MayJuun. MayJuun is a startup that is focused by clinicians on building cross-platform healthcare apps that serve a number of various healthcare-focused roles, including for patients, for EMS, at the bedside by doctors, nurses, etc. We have over 50 years of clinical bedside practice in 8 countries across 4 specialties and have even wrote a textbook based on our experiences practicing in one of these countries. We have operational leadership, including bringing new technologies to states' Medicaid, including regional and departmental rollouts and leadership roles there, including serving on the board for various free clinics to improve the health of our local population and various advisory health tech roles. We have developer expertise in the languages Dart and Flutter, in Google's Cloud DevOps, as well as in FHIR. And we've built for state agencies, including New Jersey and Connecticut's Integrated Care for Kids, the American College of Emergency Physicians, and 2 EMS agencies, Western Virginia's EMS Council and the City of Radford. We have several products in this space that are live on the app stores now that include an EMS protocol that allows you to have an interactive PDF to see your guidelines on shift, an app for the emergency medicine doctor who is at the point of care, and a cross-platform application called Cuestionario that we'll demo in more detail here.
At Open City Labs, we deliver software that connects healthcare providers with human service providers and government agencies through a federated directory, enabling them to exchange data, providing a 360-degree view of the services in the community. And we provide software that empowers those providers with the contextual information so they can deliver person-centered care. So our community exchange provides a single point of eligibility enrollment for clinical and social services. Providers have a care management application where they can help their patients access those services called Navigator 360, and patients can access that software and those services via Care 360. And specifically, we use AI to improve service access, connect patients to the healthcare and human services. We then normalize all the unstructured data so that it can be reused for autofilling forms to streamline enrollment of services for programs like WIC. We can autofill up to 95% of the fields. And that data, the information about that patient, can provide informed contextual care. In addition to the ACL Challenge, which we were winners with MayJuun, Open City Labs is a award-winning company, having won awards from organizations like Robert Wood Johnson Foundation, Catalyst, and I was recognized as an interoperability hero. So we have an outstanding team with experience, both direct experience in the kind of healthcare and social service delivery, and in AI and the technology and standards around the exchange of clinical and SDOH data. We sit on way too many standards bodies and have participated in a CMS Gravity and National Directory Connectathon last July, and more recently in Human Service Directory Connectathon. One of the consortia that we participated in was called the National Interoperability Collaboratives Project Unify. This is a community of networks working to increase collaboration within and across domains by demonstrating standards-based interoperability. As part of this, it was funded by the Integrated Care for Kids program, a CMS Innovation Grant, and it explored a user story of Sarah, who had opiate addiction and as a result crashed her car, then her children had to move in with their grandparents. This raised a variety of needs, and the needs for these systems to be able to exchange data to enable providers to have access to the information they need to deliver care and to reuse data to streamline access to services. So Open City Labs was part of Project Unify and participated in a variety of proof of concept demos integrating with other systems, including homeless management information system. And we met MayJuun when we demoed in January of 2021. And there were a variety of other demos later in the year. The demo that we met with MayJuun involved MayJuun's Prepare survey app and pulling that data into a common FHIR server when our product navigator could then populate that food insecurity and child care insecurity, and then use EHR data to autofill WIC applications and make referrals to child care providers. We met up with MayJuun after we were brought on to provide referral management for the New Jersey Integrated Care for Kids program. And New Jersey Inc. was made up of Hackensack Meridian Health and Visiting Nurses Association Health Group, Central New Jersey, and 75 Partnership Council member organizations, everything from the state Medicaid agency to the local Boys and Girls Club, child care providers, foster care providers. And the purpose is to serve 140,000 Medicaid children under the age of 21 and to really develop a new model of pediatric care based on early identification of children who are at risk. That would be MayJuun's product with the assessment, and prevention and connecting those children and families to the social services and clinical services that will address health and well-being, and ideally avoid the kinds of traumatic events, whether it's mom's addicted to drugs or dad's abusive or just financial or food insecurity.
Over the years, I've been a huge fan of using this building block analogy when considering efforts that are in the open source and interoperability spaces. In large part because I think it's important that you have something that can build upon something else and that can be easily interchanged with something that is in a similar space. FHIR-FLI is designed to be one of those building blocks, and it is the FHIR standard with Flutter library integration. And we do have permission to use the FHIR-FLI title. It is not necessarily an endorsement by HL7. So Flutter, if you've not heard of, is the cross-platform UI toolkit created by Google that allows you to build an app for any screen. And by any screen, we mean Android, iOS, the web, Mac, PC, and Linux. So all 6 platforms where you can make a screen, you can build an app with Flutter. It's since it went live in December of 2018, it has grown a lot. It's in Toyota's cars, it's in your eBay app, BMW app, New York Times, the Brazilian government, and a total of about 500,000 apps since it went live in 2018. And there's good reason, because people who develop in Dart and Flutter love it. It makes your life much easier and can definitely speed you up. FHIR, being the Fast Healthcare Interoperability Resources by HL7, has essentially all of the resources that we will use within healthcare. And what we did with FHIR-FLI was we essentially took the published versions of R4, STU3, DSTU2, and R5 preview, including all of its various test cases, and connected it into code so that you can build things with Flutter. So you can display FHIR efforts really kind of however you would like, and then you can connect to the FHIR servers that will accept them. And we've connected to Google Cloud's Healthcare API, Happy and its iterations, including Interoperability LAN, AidBox, Microsoft Azure, and others. And we've done Smart on FHIR app launches, including Logica Sandbox and Meld. In all, the FHIR-FLI efforts, which are open source, are about 10 million lines of code, which this is from 3 separate code counters, and is about 1.8 million lines of Dart, and about 30,000 files. There's an estimated cost to develop in the millions, hundreds of millions to be exact, and that is the building block that we call FHIR-FLI. It builds directly on the efforts of Flutter, as well as the efforts of FHIR. And when you think of that next level up that we've created, really that's Cuestionario. So our efforts towards Cuestionario began with the open source FHIR-FLI efforts that I described just before. We reached out to the ONC and specifically asked what area made the most sense for us to help, and they had suggested social determinants. So we built an open source cross-platform Android and iOS app that harnessed the Prepare survey from the National Association of Community Health Centers and translated into the 26 languages that Prepare is available. From those efforts, we realized that building an app on a single survey was actually better if we just scaled it so that it could work with any survey that was available in FHIR. And that's essentially what Cuestionario is. We take industry standard questionnaires, be they CRAFT, PEARLS, PHQ-9, or really any of the questions that are available. We harness multiple language translations as well as accessibility options. So if your screen text is larger on your phone, we'll adapt to that. If you need screen readers, particularly for Android, it will read off the questions to you. And then we harness standards for data exchange, including secure authentication, Smart on FHIR, pretty complex calculations from this data capture, as well as translations that are embedded directly into FHIR so that you can harness them in other efforts as well. All of this we call Cuestionario, which is our implementation of dynamic questionnaire assessments within FHIR-FLI. And this has different brands based on the clients that we've worked with. For New Jersey's Integrated Care for Kids, it's called Health Story. For Connecticut's Integrated Care for Kids, it's called Health Journey. And really, I think this is just better shown. So when you look through from FHIR's website on hl7.org, they have a structured data capture of essentially how you can take questionnaires and value sets, and then you have questionnaire responses. And this is essentially how you can do that entire aspect. And there really aren't a whole lot of I'll just say complex examples that are published. We are one of the few that has actually published the entire end-to-end utilization of the questionnaire, the task that kind of puts all that stuff together, and then how you're able to harness these scores and essentially take the answer responses and gain additional insights from that on a very high level. So that becomes really, really useful when people are answering multiple questions, where you can basically figure out, what their various score is and what their overall risk is. So essentially what you're looking at here is a cross-platform representation of Cuestionario. On the left side here is an Android iteration. On the middle is an iPhone iteration, and we also have web variations of this as well. This allows you to open the app native to Android and iOS, or just to have this available either on your phone or a computer or a tablet without a high barrier to entry to getting to these questionnaires. Of note, we have different themes and light and dark mode, of course, but then we essentially will allow you to work, and this is essentially the same code base, and we can change the way that these questions are displayed. We can change the themes. We can change a lot of stuff pretty quickly. And so if you look, if I just change the way that blue color is, and I decide I want it to be a different color of green, I can do that. I can really change any of the icons and content that is directly within this app. In the app itself, we can harness a number of different aspects of a questionnaire dynamically, including radio buttons, including checkboxes, including nested groups. So if I was scrolling up and down between personal characteristics, prepare, family and home, and others, we can do that pretty easily. We can also harness branching logic within our questionnaires. So for example, if I answer, this is craft, if I answer this with the affirmative, as craft is designed, where if I say anything that's greater than 1, then it will give me additional questions below as well to fill out. And the other aspects that are really, really useful for here as we're going through this are languages. And so it may default, if my phone is in Spanish, it will show me everything in Spanish, or you can set this custom as well. And as I mentioned, all of the languages are embedded directly into FHIR, which will make it a lot easier as you are filling out these various questions and questionnaires, and so that it can translate more easily from one use case to the next. One of the things that we've done to try and lower the barrier to entry with our clients was handling logic, translations, and the content within the app as well as within these questionnaires via spreadsheet. And this really, really eases that barrier to entry as you are looking from the perspective of working with other language experts to make sure that these translations are useful and helpful for your patient population. Flutter out of the box supports about 80 languages. We've also built applications that harness custom languages that weren't even supported by Flutter. The specific example being Haitian Creole. So one of the other benefits that we have of essentially including questionnaires of various types, various languages, and app essentially launched either through Android, iOS, the web, or otherwise, allows us to be very dynamic in the way that we're actually loading these questions as well. And so for the ACL Social Care Referrals Challenge, as part of one of the affinity group presentations, we had actually demoed a live Smart on FHIR app launch inside of the Logica Sandbox as a simulated EHR. And that launch we've been optimizing as well, so that if you are in an EMR, you really don't have to skip out of that system if you don't need to assign a group of questionnaires or individual questionnaires or some variation therein, as well as to be able to see the responses, including scores and including individual responses for a single question or a series of questions. So this essentially makes it so that you don't have to leave the sandbox of your EMR, which is all the more powerful when you're looking through interoperability and scalability. The link to this 10-minute video from our demo with OpenCity Labs is available here. I'll end by mentioning that our efforts and our assessments can connect either through Smart on FHIR app launch or custom portals that connect into FHIR interfaces, or really a number of dynamic ways, so that whenever the questions are actually filled out and the needs assessments are done, we can then work with our colleagues, such as those at OpenCity Labs, to harness the responses that have then generated goals and conditions that help trigger this closed loop social care referral.
This is a demo of Navigator 360. Here we can see care coordinator Carla Sanchez from Hackensack Marine Health is using the product. She can receive updates or notifications about her patients, changes in major things like food insecurity or other conditions. In this case, we are looking at Sarah Marie Thompson's record, and she's housing unstable and she has food insecurity. So let's do a resource search. So a few things to note about our directory. First, it's a federated directory, meaning we can search either in the aggregate directory via OpenCity Labs or look at individual unique directories and search them individually. And each of these sources retain ownership of their directory data. So we not only don't own the data that they're contributing, they actually have opportunities to make licensing revenue on that. The second thing is that these programs are automatically recommended based on the conditions of the patient. So in this case, she's housing unstable, so we're recommending a housing voucher program, the Medicaid long-term and services and support because she's living with her mother who's elderly, and we have a nutrition sites program here because she's food insecure. So let's go ahead and screen for eligibility for the nutrition sites program. So because Sarah is living with her elderly mother, and this is a household age, we're just going to answer a question. The eligibility questions get significantly more complex with other programs, but we want to keep it simple. And based on those answers, we see she is eligible for the nutrition sites program. So let's go ahead and make a referral. So this is a referral for food insecurity. We could request that the recipient provide some kind of assessment, but we're just going to keep it simple. This is a typical routine referral. This is contributing to a plan. The goal that is associated with this referral is food security, and the reason for this referral is food insecurity. We have the option of sharing this referral with the patient, and this field reflects the type of endpoints where this the recipients of this referral can receive this. In this case, it will automatically default to email, and then we're just going to click next. I'm going to collect consent from the patient. Here we have a template email you're going to see later. The referral has been successfully sent. This is an email I received from the perspective of the recipient of the referral. So Carlos Sanchez has sent this message, and I'm just simply going to click on this link and it's going to prompt me to log in. So if we want to update the status of the referral, we just simply select this. We're going to mark this as accepted. And we can go in here and document our procedures. So education about home delivered meals program, for example. Evaluation of eligibility for home delivered meals. And we'll document a provision of home delivered meals. So we've completed the services, we've documented the services that we've delivered, and now Riza Shah, who's received this referral, he's going to actually help her with housing as well. So when a referral is received, we also generate a task to meet that referral. So if I click this, it would just take me back to the referral that you saw in the previous screen. But we're going to create a task, and we're going to create a task to help Sarah Marie Thompson to help her access a housing program. In particular, we're just going to assign this to, we could assign it to the patient, but we're just going to assign it to myself. And so I'm going to create this task, and when I click perform, it's simply just going to take me to the form. Now, what you're looking at here is a OpenCity Labs generated web responsive form. So we use AI to parse unstructured text, and then we pull in all the data that we have for that particular patient and autofill the form. so that it becomes a lot easier for her to access this service, right? And now when I click save, it's going to populate the PDF form, because there's a lot of government benefits that require people to use the specific PDF forms that these government agencies accept, right? So we have integrations, we have forms from over 30 different government agencies, and then they can be e-faxed from the screen or downloaded, printed, and taken in. And of course, we are open to partnerships where, our long-term vision is to be able to send that data directly to the agency, but these types of integrations can become very expensive. So next I'm going to show you Person 360. And so what happens here is, so in the last page, you saw that there was financial income that we populated in the form. So what we've done is, before each engagement, we identify the forms that are relevant to the services needed, and then we go in and we use our AI to populate and auto map across various data for these fields, and human, of course, verifies it. And then this data gets organized into these categories. Again, these are data that are not traditionally found in a traditional medical record, like income. And so what we're able to do is capture all that data and it's sourced before it gets submitted through the e-fax from the screen. And at every step you saw, for example, when I was documenting those procedures, you're going to see that we automatically document and track all the procedures associated with the gravity codes for interventions. So you saw me help Sarah Marie Thompson with the application for the Continuum of Care Rental Assistance Program. You saw me document the Education for Home Delivers Meals program. So, and finally, I'm just going to show you the care plans. And we support a variety of care plans. This is a FHIR care plan with actions and next steps for Sarah. This is from the American Academy of Pediatrics, where there are a variety of care plans. This is emergency care plan, my home care plan, dental, eye doctor, and primary care, and home care plan, audiology care plan. So that's all I have for our demo. Thanks.
So building off of these efforts of interoperability and open source that serve as the backbones for all of these things that we do in collaboration with other groups, both in the public and the private sectors, we hope the elements that we've shown both from the MayJuun side as well as from Open City Labs helps demonstrate our strong desire and passion and willingness to work with other groups that are interested in a similar space. As I mentioned from the efforts that we've done with regards to dynamic assessments, the incorporation of spreadsheets that then turn into FHIR code. So we'll make a few changes and that then modifies almost 80 to 100,000 lines of JSON, which would be really challenging to do if you were doing all this stuff by hand. That sped up a lot of the efforts that we were doing with both Integrated Care for Kids programs. The Gravity Project has published a success story on MayJuun and Open City Labs efforts transforming assessments and referrals for New Jersey's residents over the INC program. And the Administration for Community Living just announced us as one of the 3 grand prize winners, as well as a bonus phase winner for what was essentially a 2.5-year effort and nationwide challenge. FHIR-FLI, I mention as a series of packages that you use to connect FHIR into Flutter. And there's really a global collaboration that builds from this as well. There are about 150 people across the globe that have harnessed FHIR-FLI in the 7 countries that you see here. And we're happy to continue to build and to scale in a manner that helps advance healthcare for all. I'm John Manning through MayJuun and Matt Bishop from Open City Labs. We're happy to have this opportunity to speak, and we are welcome any additional conversations, both online and offline. Thank you so much.